Hi all, how are you? Welcome. We start at the top of the hour, so let's give it some minutes for other colleagues to join in. Get comfortable.
Good morning, good afternoon. Molo Mamzondi.
Good morning. morning, Agan. Is everybody there? Or is it silent?
Hello.
Oh,
Except for you, Yvette, I've been saying good morning and no responses.
oh, okay. I'm like, yo, are we in a silent Zoom?
I see you guys are already behaving like these people from other continents, calling it good morning when we are not in morning.
But we are here.
But
Mos.
we are here.
We
I'm just
can't say-
jealous. I'm just
we
jealous.
We can't say good afternoon in the morning.
I
You
was
can
muted.
try. You can
Somebody's
try.
telling me I'm hearing good morning, but we were muted. But now, good morning, everyone.
Oh, Bridget, did you mute us? Bridget, did you mute us?
From Europe is the afternoon and must say good morning for everybody.
Thank you.
Hello, everyone. You're welcome. We should be starting in a minute now. Thank you for joining.
Yes, we are here. Angelo, are you agreeing with Ida?
He's not answering, but he was agreeing with me.
Oh, so I say
Yeah.
oh, to register that I'm still from South Africa. Oh,
Exactly, Angelo. Thank you. FOMO makes you catch these things. That's all I can say.
catch feelings. Don't worry, we miss you, Angelo. Don't worry. We miss you.
All right. Thank you all again for joining. Good morning and good afternoon from wherever it is that you're listening from. Thank you again for joining our first debrief from HIVR4P conference. It is very lovely and refreshing to have you all on the call today. My name is Bridget Ndagano Juko, and I'm the Regional Partnerships Manager at AVAC. I'm based in Kampala, Uganda. A special thank you to the team joining in from Lima, as this is really quite early for you all. But then again, we get the honor to start the day with you as you take on HIVR4P. We are very, very grateful. So just a little bit about the virtual debriefs. These are part of the Advocates Corner happening physically at the HIVR4P conference in Lima, Peru. And the Advocates Corner is an initiative of the AVAC supported, it's an initiative of AVAC and it's supported by the CASPA project that some of you may know about. We will be having these quick calls every day, same time, going up to Thursday, which means we have one today, one tomorrow, and then one on Thursday. And everyone is welcome to attend. It doesn't even matter if you have a conference registration or not. Please share this with your networks. Everyone is invited for these calls. So in terms of the conference, it's already 2 days into the conference, and so far a lot has been covered. Very, very interesting, insightful, and informative conversations are happening. And, we are seeing advocates and communities representing at the conference. I am trying as much as possible to attend virtually because the time difference is really crazy. But thank you all for, just representing us at the conference for those that are in Lima. So diving into the reason of our call today, with me, I have 3 speakers that will come in to share a few highlights from the 2 days so far at the conference. They will share with us an overview of what is happening, where is the conference at in terms of research. Is there any new data that has been released so far? Any advocacy highlights, and really just anything to look out for as the conference unravels. So for starters, and she did such an amazing opening of a session that I was honored to watch. Join me to invite Jerop, who is a young woman, very passionate about HIV prevention for adolescent girls and young women. She's also a member of the Young Women's HIV Prevention Council, hosted at HIVR4P, and it has been really a very lovely time to work with her. But Jerop is very vocal as a young woman, but also she's been quite vocal at the conference in terms of what it means to engage adolescent girls and young women. So Jerop, I want to hand this over to you to just tell us how the conference is going these 2 days, what you've been able to take part in, but also, those key highlights that have come up and what to look forward to as we move forward in the conference. Jerop, the floor is yours.
Thank you so much, Bridget. Good morning. Oh, it's good morning where I am. So good morning, good afternoon, or good evening to everyone who's listening in and who's joined us.
Jerop, if you're speaking, we can't hear you.
We
Oh,
can hear her, Jira. Bridget.
Yeah, we can hear her.
Looks like you're unmuted, actually.
oh no, I was on mute. Okay.
I hear her very well.
Ah, perfect.
We
I
can
hear
hear.
her very well from Nairobi.
All right.
Yay. Okay. So thank you so much, Bridget and Team HIVR4P, for this opportunity. I mean, this is one of those conferences we always look forward to as HIV prevention advocates and champions, because it's one of those spaces we get to really focus on HIV prevention, not only the science part of it, but also the other side where we're thinking about social and structural factors and biomedical stuff, really holistically HIV prevention. So it has been an honor. The past 2 days have been quite interesting, with so much science to process and to learn, and so much new interventions, ongoing research to catch up with. But most importantly, for me, is some of the sessions that I have participated in. So on Sunday, which was like the official day 1 for the conference, I had 2 sessions. One was for the dual prevention pill, where I was literally not only co-moderating the session with Mitchell, but also really giving a perspective of what adolescent girls and young women envision, what are some of the challenges globally, but also in sub-Saharan Africa, but also to really put out the voice out there that as young women, we are actually quite looking forward to DPP. So for those of you who've not heard about DPP, DPP is a dual prevention pill. It is an a very quick upcoming multi-purpose prevention tool. And multi-purpose is because it's going to be preventing HIV and pregnancy at the same time. So hence the name dual. And it's currently in the process, and as young women, as advocates in the space, we're looking forward to it. We have a dual prevention civil society group, which I actually am the chair, and a lot of our work is now to think about DPP introductory, what we want DPP to look like, what we want it to feel like, and that was some of the sessions that was the panel discussion we had on DPP, but also looking at already existing products, the oral PrEP, the ring, Kabele, which is still in process of getting into our countries. What has that looked like? What are some of the challenges we're experiencing? What are some of the successes with product introductory that we've seen with previous PrEP options, so that we make sure as we think about DPP, we are able to learn from the lessons of existing methods, but also to make sure that we have a smooth introductory of DPP. So that was one of my sessions, and it was quite interesting to hear from researchers, and Kate from HIVR really gave us an overview of the research process and how it works and what's going on, and the timeline they envision. But also we had young women, we had Rhoda who came in to just share the perspective of young women and advocates, and our role as communities to be able to champion for availability of choice and also option, and what that actually looks like. My second session was a session on PrEP options, but really thinking about HIVR and what challenges they're facing, and what are these things that are really hindering them from accessing products and utilizing prevention products. A lot of times I know we say it's accessibility, it's availability, but majorly it's a lot of social and structural challenges that our communities continue to face. It is broken health systems, it is an availability of quality service delivery, and a lot of times we say youth-friendly centered service delivery. We say a lot of times it is lack of empowerment and information. I mean, there's so much information here at HIVR4P, but I can't help but feel like this is information that is just circulating amongst us in the space, while yet many who are outside of this space need to have this information. So we were discussing about, I was sharing about social issues and structural barriers that continue to hinder HIVR from accessing and utilizing already existing PrEP options, but also what are some of the things and interventions in terms of programming that scientists, developers, and funders can actually think about to be able to make sure that as much as we have choices and options, that actually the people who need it the most are able to utilize it. And there were so many other sessions. And I guess for me, one of the most interesting part of the conference was a GPP session that we had yesterday. And really thinking about how our communities are engaged in research. What does that look like? And a lot of times, good participatory practice, that is what GPP is. And for our communities, we know a lot of times they agree to participate and be part of research trials and research because of an incentive, because they're really not well empowered, and many researchers don't take time to empower communities so that they understand why is this important. So for me, it was a session that really highlighted why it is important for researchers and people who are doing any trials to help communities to understand what is the social value of them participating in this research, so that we don't just use communities, we don't take advantage of their vulnerabilities and give them incentives and they are excited to participate, but we really help them to understand why their participation is important, how this research will be helpful, why we're actually doing it, and what is actually the social value of this research. So there's so much that is going on, and I'm really looking forward to to sharing this information, but also helping funders and donors and scientists to realize that we cannot solve the epidemic without partnership. Communities should not just be at the end of the receiving side. They shouldn't just be beneficiaries, and we shouldn't just be brought into these spaces for face value and for them to take our pictures and say we had communities in the room, but to actually look at us as equal partners, equal stakeholders, who are bringing value and expertise and our lived experiences on the table, and that should be taken into account. So for me, I think those are some of my highlights, but also that in almost all the sessions, guys, there are young women in those sessions. Literally, many and a huge percentage of all these sessions, there's a community voice in that panel discussion. Literally, there's a huge balance of science and community perspective. And I think for me, that makes me happy, because even when we're talking about vaccine, there's a young person who is there. Even when you're talking about research processes and child design, there's a young person who is there. So for me, it's that this conference gives us an opportunity to voice out our expertise, voice out what we need to do differently, but also partner with scientists and communities in the space. So I'd really highlight those as my key aspect, and I look forward to sharing more.
Thank you so much, Jerome. And of course, it's very good to hear that, we are just waving the youth engagement high, and just knowing that there's representation there. But I think what I picked out mostly from what you've shared is how do we take that information out of the rooms that we are sitting in to take it to the communities? And I mean, what is actually community engagement when we are talking about involving adolescent girls and young women, and how do we make them part of the processes? I think for me, that is a very, very key takeaway. And we'll get time, colleagues, to just chime in. And I see a number of us on the call that actually are in the conference itself. So please do use the chat, but also there's going to be time for us to, just come in and give our thoughts from what they've presented to us. So I want to call, right now, Ntando. Yola Ntando is a seasoned advocate. He's really big on community engagement. When you talk about GPP, he's a very, very big advocate of good participatory practice. And you see his work really focuses on ethically and equitably engaging communities in research. Ntando has had a presence at HIVR4P, and I want to invite him to share what his experience has been so far, and some of the takeaways that he, could share with us. And Ntando, I saw you in the HIV vaccine session. You were doing amazing, and I hope those are some of the things you share with us today. Ntando, you can take the floor now.
Thank you very much, Bridget, and good afternoon, everyone, and good morning for those who are in the morning zone. So, I mean, one of the big takeaways and exciting things, which I think goes with this label of being called a seasoned advocate, and I guess, seeing a lot of young people, you probably indeed feel seasoned, which is a good way, I mean, a nice way of saying you are actually quite old or aging. So, but it was truly amazing and motivating to really see, a lot of young people, I think, as we have heard from Jerome and many others who were just cutting across and really, affirming and making their presence felt and their voices felt, which I think speaks to what I think it's, for me, it's why the reason it is motivating is the fact that we have always said, we cannot come to these conferences and leave young people, and we speak about young people. And now I think I'm really seeing that changing, and I think it is very exciting for me. And of course, and embracing and accepting being a seasoned old advocate. But I think, that's just one of the exciting things. So I think as Jerome has mentioned, at this conference, you looking at what is happening in the pipeline and what is happening, on things that are outside the pipeline, which is all the questions we are asking about and we're talking about in as far as what is available and, how is it available? Is it indeed available? And I think a lot of reference, as we know, is that there has just been a question about how are we doing as we go into the 2025 targets, which is in a few months. And of course, the message is no. And then take it to another 5 years to 2030. And again, the answer there in as far as how we are doing. And, if we're going to meet any of these targets, it is a no. And I think that becomes a challenge, and not a challenge that we definitely are, should be able to meet these targets, but I think these targets are important really as a measure of how well we are doing. And I think that is a challenge for all of us, in particular as advocates on the work that we do and how and the things that we are calling for. So that really has been a base as a question of reference in all of the work that we are doing. So as you say, Bridget, a lot of what I've been drawn to is stuff that is happening, in the pipeline, in the early research work that is happening. And that includes a lot of work that has been shared through the metrics work, where they are looking at a lot of interventions that are non-ARV based. And I have all been very much engaged on the work around vaccines and broadly neutralizing antibodies, which is another component of non-ARV technologies that we're looking at. And I think one of the main questions is really highlighting why it is important why do we still need an HIV vaccine? And I think that really has become quite a question with a lot that is happening. So within that question really is that we know, and this has been the case in all of the HIV vaccine and broadly neutralizing antibody work, as well as the discovery medicine vaccine trials work, which are some of the concepts that I'll probably touch on briefly, that, we know with an HIV vaccine that we do not have. And one of the things I've learned, that it's important to highlight that we do not have a vaccine. And that's a very important messaging, because I think at the session, one of the people really asked, how is this vaccine doing? What is happening? And I think that was a message about how we have to revamp and strengthen our communication around HIV vaccine research. So, and I think part of the HIV vaccine conversation includes the antibody research work, which is another mechanism that is, adding to a different look, in the sense that we do not have a vaccine and there's a lot of work, but there are these antibodies which directly infused and really work as a form of a vaccine, but one that will not particularly help the immune system to produce, to fight an infection, but one that where it's almost like a vaccine that you get given on a constant basis. And there's a lot of work in really understanding a range of antibodies that we have and how they are coming in the pipeline. And again, the question is, why is there a need to invest in all of this work? And in part, as part of that conversation, it's actually, how will a vaccine work? And in fact, how will the broadly neutralizing or even monoclonal antibodies be better than what we have in as far as the ARV-based interventions? So there has really been a lot of those conversations. Another important aspect as part of this HIV vaccine broadly neutralizing antibody work is really the whole question about how do we, as we go along, really learn from the ARV-based interventions that we have, the long-acting PrEP products that are known to work but are not available. So there are a lot of conversations that are happening that include all the patent issues, the production, the availability of these products actually, which brings an important aspect of a conversation about the manufacturing capabilities in order for us to be able to have all of these antibodies. Then another concept is the whole concept of not doing large or at least big trials, but doing discovery medicine trials, vaccine trials, which are very small questions about products that are going to inform the whole HIV and BNABs, including cure research. So those really are the conversations that I have been mostly part of. And the message there is that there's a lot more that needs to be done. And of course, that is the message across the board. And I think it challenges our advocacy as we look into a number of issues. The availability of these products in order for them to be able to go into testing, what we are talking about in really learning from what we have today and getting ready to be able to have proper equity conversations in as far, or at least plans in as far as access is concerned. But I think above everything is that what we have should really work, and we should do as much with what we have. So I think briefly, those are some of my takeaways, without really taking a lot of time from the early days. And we are now going to go into a plenary that is also going to start the day and really, address exactly the same issues. And I think, as everybody might have seen, the plenary is on new tools, new challenges. And I think that really captures everything. Thank you very much, Bridget.
Thank you so much, Ntando. And I know there's, a lot of conversations around vaccines, but mostly I think thinking about HIVR4P, what was big on my mind was, what vaccine research looks like in the era where we have longer acting PrEP. And I think it's a big question for everyone. And I think that would be a discussion that, we really take on. Without any further ado, I want to invite Manju Chatani. She's a director of partnerships and capacity strengthening at HIVR. And Manju's work is highly centered around expanding and strengthening the network of HIV prevention advocates. And she has really contributed a wealth around, biomedical HIV prevention research, especially that's centering women. And we love women. We want to hear women-centered approaches. I know, Manju, you are doing something around pregnant and lactating persons at the conference, and possibly more at the conference. I want to invite you to share your experience there and some of the highlights that you want us to take from the conference so far.
Thanks, Bridget, and thanks so much for putting this together. It's great to see so many advocates and others join, both from the conference. So kudos to you for a 7 a.m. join, and also so many from other places. There are so many of us on the phone, on the Zoom, Bridget, from the conference. So I'll speak really briefly so that if others want to pipe in, they really should. I really just have to emphasize, just the way Ntando did when he started, just how exciting it is to see young people lead the discussions, chair the discussions, and do it with so much confidence, so much knowledge, really, really specific recommendations. And something Yvette Raphael said at one of the sessions, I think it was on centering choice. And she said that the next step is really for young people to ensure access to prevention, that we have done the work of really screaming for more choice and prevention, but it is young people's prevolution to make sure that there's prevention. And I think that is a challenge, but I feel so confident that young people will rise to that after seeing them in every space. And what's important is in the note of the growing power of advocates is that we called for this. We called for more young people to be in these spaces. And finally, we're starting to see them. I will note, though, being a little cautious, that this was in the satellite sessions that are organized by different entities, many of them AVAC's partners as well. And I think it'll be curious to see if we see that when the actual conference starts, when we see the abstracts. That's where I think we should also be looking out. So among many sessions I went to, I'm just going to highlight a couple of things that I thought were really exciting. One of them was last night, for those of you who were able to watch, was the plenary, first of all, by Dr. Jeannie Marazzo, that is always amazing, and many of the things that Ntando said were covered by her. But what was really amazing is to see Anne Philpott of the Pleasure Project have a plenary that talked about the role of pleasure in HIV prevention, and a meta-analysis they had done to see all those interventions in small ways and in larger ways talk about pleasure in HIV prevention and what impact did it actually have. And she showed that when pleasure is integrated, in the sense that acknowledging people want pleasure through intimacy, people want pleasure when they're having sex, when they're choosing partners, and to really center their experience about what they want, you can have a much easier conversation about prevention. And her meta-analysis showed that when you talked about pleasure over the board in smaller ways and in much more profound ways, it increased the use of preventions, and it helped people stay on prevention that they actually would work when they thought about it in their context. So I really, if you didn't watch that plenary, I really suggest you do. It was very powerful, and it was also great that in all these years to have someone at the opening plenary actually talk about pleasure when we've been talking about sex for 30 years when it comes to HIV prevention. The other thing, and Bridget, you mentioned this earlier, was the focus of ensuring access and inclusion of pregnant and lactating people in research. I was really happy to see when I walked around some of the posters that will be presented in the next few days, how many posters were actually looking at pregnant and breastfeeding women in several, in Kenya, in South Africa, in Uganda, looking at their choices in prevention and what made them comfortable and how they were using it. And they looked also at access of pregnant women to prevention tools. So the studies on choice was interesting. There was as you can imagine, there was a lot of variety between different countries. In one study in particular that I looked at in Kenya, there was much higher interest in using oral pills versus injectables or implants or the ring. So it's going to be interesting to really see, as more information, as more people are using these products, how that choice changes. And the big satellite that we put together, and I was really very proud to be part of, was on catalyzing progress in calling for inclusion of pregnant and lactating people, and more specifically women in this discussion into research. Besides Linda Gale Becker, who gave an overview of the field, Dr. Lisa Noguchi talked about how amazing it is to see that we are really seeing a trend across research of the inclusion in cabotegravir, lenacapavir. Of course, we had studies on the ring, oral oral pills, but there's still more to do. We still don't have any BNAB studies that are including pregnant women. Yes, we know they are for pediatrics. So there's still some work to do on that. And across all the speakers talked about how important it was to collaborate together to move the field forward. And a similar thing made in the amazing launch of the People's Research Agenda that I think we have Grace on the line, or Stacy, who should really talk about, but it was really incredible. But just like the People's Research Agenda called, that it's about partnerships and engage in to shift the field and not just have advocates and community voices as members of consultations and advisory groups, which is really important, but really be partners at the high table to move the agenda, to shape the policy. And so that was really exciting. I'm going to stop, Bridget, unless there are any more, just because I see so many speakers, so many attendees of the conference on the line. So I want to ensure we have time for many others.
Thank you so much, Manju. And those are really, really beautiful takeaways from the conference. And again, it's just day 2. And there's so many other sessions that are happening today into tomorrow and Thursday. But I want to just put it out there, anyone, and I know we have quite a number of conference attendees on the call, and the chat is hot. So I just want to, I just invite anyone that's attending the conference that really wants to give some insight. And of course, a conference is not a conference without any demonstrations. Is advocates thinking of something? Is something happening, as we speak? Have we seen any protests happening at the conference? We really would want to know what's happening. But mostly, Jim, if you're available, just to get off mute and say something. Jim, as you prep yourself, Nombeko, go right ahead.
Hi, Bridget. Hi, everyone. Thank you so much for allowing the space. The conference has been amazing, as it has been reflected by the previous speakers. There was a march, a demonstration yesterday outside, people from the area, from local protesting about the research not taking care of the needs of the people within the area, transgender people and all. So it was interesting. We're hoping to see them today again. And then also, it has been raised, young people have done such an amazing work. The sexual pleasure talk has opened our eyes. I just can't get over the presentation of a female condom, when it was we were not sure what is it at first, but the way the lady brought it up to us so that we can better inform people during the education session was amazing. So that's my piece for now. Thank you.
Thank you.
You want me to jump in?
Yes, Jim, go right ahead.
Great. Good morning, good afternoon, good evening, everybody. It's Jim Pickett, live from my hotel room in Lima. So I wanted to just talk about, there is a lot of conversation here about the terrible exclusion of this region from access from Gilead's historic licensing deal with 120 countries. Great for those 120 countries, but 4 countries that contributed their time and volunteers contributed their bodies to the research that led to lenacapavir showing it worked, were left out. And those countries include the birthplace of PrEP, Peru. They include Argentina, Brazil, and Mexico. And there are a number of advocates here from Peru, Brazil, and Argentina. We have not seen any demonstrations per se about this. I mean, I think folks who understand the region it has its own dynamics and its own politics. So they're having discussions, but I'm not sure exactly. I think this is a case for locals have to take the lead. That said, all of us who are in the conference, and I'll say a lot of advocates and communities here have no access to this conference. They cannot get in. It's an extremely expensive. So that, you know, speaking truth right to Gilead is very difficult here. So I think those of us who are in this at the conference and have the opportunity to get on a microphone, whether they're moderating a session or they're asking a question in a session about prevention or lenacapavir, there's a hell of a lot of talk about lenacapavir here being the big game changer. But there's no change in the game if you're not allowed on the field and you're not allowed to kick the ball or whatever you do on the field, right? If you're not allowed on the field, there's no changing any game. So I'm going to give one example of a place that I would love to see people show up and be loud and ask questions. I happen to be moderating a session today at 10. I'm sorry, let's see, is it 10 or 10:30? It's a section called Novel Antiretrovirals and Formulations for Prevention. It starts at 11, so my bad. It starts at 11. I'm co-moderating with Beatrice Greenstein, who is she's from Brazil, researcher from Brazil, and she's the president of IES. And in this session, there will be 2 talks focused on LEN. One will be on the results from Purpose 2, and the other one will be a talk focused on the quite good racial, ethnic, and gender diversity among participants among multiple talks. So there's multiple abstracts being presented here. There are 2 on LEN, and then there's like 5 others. So they're all quick talks, and then there'll be time for QA. I am definitely going to make sure that the elephant in the room is called out and that we ask about very directly to Gilead representatives what's happening with access, what are the plans for Peru and the other countries I mentioned. These questions have been asked in other sessions, and we've gotten a lot of blah, 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 and spin, 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 and essentially no answer. Now, the person who is presenting the Purpose 2 results in the session I'm moderating is from Emory. She is not a Gilead representative, but we know Gilead will be in the room. This is obviously an important talk. It's the first time these results are being presented at a conference. So if folks are at the conference and you are able to come to this session at 11, I would highly encourage you to come and to amplify these questions. If someone isn't going to ask the question, I'll ask it right from the moderator's podium, but it would be great to have these questions and concerns coming from the audience. And I'll just sort of wind up my little rant here by saying I've been very heartened to see so many African advocates and African organizations coming out in solidarity with the countries who have been left out. I mean, we can be happy for access in our own country and still demand solidarity, or still show solidarity and demand access for everybody in the world who needs access, and particularly to countries that hosted these studies, that recruited volunteers from their populations, who have contributed to this historic, quote unquote, game-changing drug, and are now just being left out, and there's no concrete plans that we can see. So we need to demand those things. And I'll end it there.
Thank you so much, Jim. I think to add a voice to that, and of course, just lining up some opportunities for advocacy at the conference. There is a question in the chat, and I mean, feel free, colleagues, to come off mute and share your experience at the conference, but also, I mean, if you do have written questions, go ahead. And Simon was actually going to call out to you because I see you're quite active in the chat. Go right ahead. And Simon, as you speak, I would want to ask Tandon. Tandon, there was a question from Annette asking if there are any specific reasons why pregnant and lactating people haven't been included in BNAB research, or is it just a typical exclusion? If you have an answer to that, please, you will let us know. Simon, go right ahead.
Hey, thanks. Just 2 really quick points. One is over lenacapavir. Please just pretend it is a vaccine. You have 1 shot. and then you have a booster shot. You have 2 shots a year. You have 100% protection virtually. There's no vaccine will ever have 100% protection. We have our HIV vaccine for all intensive purposes in terms of prevention. If a vaccine was released yesterday, would we be talking about this in terms of getting access in a couple of years' time and pricing? This is crazy. We should be demanding urgent, exceptional approaches to lenacapavir in order for us all to be, protected and to see the goals we want. And the second point is the Richard Stern article about access to oral PrEP in Latin America, 16 Latin American countries, included that Peru, which was a site in the IPREX study. So the oral study that got oral PrEP approved in the US was called IPREX. It was published in 2010. It was researched in Peru, and last year only less than 1,300 people get access to oral PrEP. So it's a complete fantasy. Middle-income countries, especially in Latin America, have no access to anything. And this is shocking. And anyone demonstrating there, please find out if this data is true. 1,300 people in a population of 33 million is terrible. But the big thing is, I think we should not be thinking of lenacapavir as the next PrEP drug or the next drug. We should be thinking of something as a vaccine level protection and demanding exceptional access. And it should be taken out of the hands of Gilead, I think. So thanks. Have a great time. Thanks for this forum. It's wonderful.
Thank you, Simon. And I think, the issue of just having communities take part in trials and these same individuals that do take part in these trials being the last to actually access the products once they are approved has to stop. And it's not just in Africa, but, just everywhere. I think this has to stop. And I think we need to have a call from advocates to take this on and talk to the researchers, talk to whoever is concerned. Ntando, do you want to come in?
Yes, I was actually trying to respond. So I think it has also been raised as an advocacy gap, and I think it's exactly the point where we were at with PrEP for a long time, with oral PrEP initially, and of course the dapivirine ring as well as the long-acting agents of PrEP. That there is a need to to be all-inclusive in terms of pregnant and lactating people. So, and I think that's the message. And in part, I think it's really this idea, and the debate between, clinical trialists and ethics bodies about the safety of PNAPs, in infants. But I think what I will say is that there is a lot to be understood about that, and that then as I think that is being understood, it opens an opportunity for advocacy of inclusive research. And I think, as Manju has mentioned, there is work that is happening for PNAPs for infants. And I think that also is really going to, what is discovered there will have implications for exactly the same question, I believe.
Thank you. Thank you, Ntando. Anyone else willing to share? And I realize this was meant to be around 45 minutes, so we have the people back at the conference really get ready for their day.
Yeah, so I'd sort of like a quick dialogue, not really dialogue, with Simon about your opening statement, which I think from an HIV vaccine perspective, and this messaging on pretending that lenacapavir is a vaccine, we are finding that it actually unintentionally really sends a message that there is a vaccine. And I think we feel it is very important to clarify that messaging, because as we have seen and as we have said, and I think as we believe it's important to really have a clear message that lenacapavir, as 6 monthly as it is not a vaccine, and really there is still a need to refocus on finding a vaccine and have a proper message around a vaccine not being available. I don't know what you think, Simon, and I probably also didn't hear you properly, but I just heard that opening comment.
And I think in Tando and Simon can come in to build on that. We've seen cases where actually LEN is reported as a vaccine, and I think that's not what we want communities to take away, because that would be misinformation. I mean, LEN is LEN. It's longer acting. It's 6 monthly, and I mean, we've learned from other implementing other projects, programs like the oral prep, you know, the community gets something and they run with it, and it gets harder to really clarify these things in the end. But I think that's a takeaway as well. We want LEN to be looked at as an injectable, a longer acting, rather than it being called a vaccine. But yes.
Grace.
Yes, Grace, go right ahead.
Yes, Bridget. No, thank you so much to everyone's contribution. I wanted to speak to something else that was happening the past 2 days alongside HIVR4P. So there are a number of journalists that were put together. They had scholarships, and they've been trained on HIV science for the past like 1.5 days, talking about the conversations that we're having here. I mention this because I know within our community, we do have people that are working in media. And one of the key issues that came out from the session that I participated in was how media is important in translating the conversation around choice. Because if people and communities understand that we do have a bucket of options at country level in the different contexts that we live in, it becomes easier for them to go into facilities and actually ask for it. So I think this conversation around choice, we also need to partner with media and see how we push this forward. Not just ministries, not just community, but super important to bring the media on the table. So I know there are people here who would be interested in that conversation, and I think the accountability bodies here as well. I think that partnership would be very important to look at. I thought I should just share that as well. Thank you.
Thank you so much, Grace. And Angelo, I see you in the chat. I was just going to say the same thing. Actually, as part of the Advocates Corner, we do have a session. AVAC has a program called the Media Science Cafes, and I see some of our conveners on the call. And there's a session in the Advocates Corner where we talk about that program, and really it's a partnership of how do we utilize or leverage on media to give the information, the right information that we want to give in terms of research and in terms of R&D and research and trials and things like that. So I think that would be a very nice session to attend. But also you make a very good point, Grace, when we say media plays a very big part in you know, just passing on communication to communities. Okay, we are getting to the top of the hour. I had someone get off mute.
Yes, it was me. I thought Grace was going to tell us about the People's Research Agenda.
Grace, I think in my slot for tomorrow, if I'm not mistaken, to you know, just give us a roundup of the People's Research Agenda.
Totally. So we had a conversation with Bridget that will do that tomorrow. So news coming in tomorrow. Thank you, Bridget and Tando.
Stay tuned. Stay tuned. Tomorrow we'll have a deep dive in that. So anything else? I think I just want to invite, I don't know if Manju, you're still on the call, on Tando, you, or even Yvette. I will be on part of our speakers on the last day. But I wanted to invite any one of you just to, you know, just wrap this up for us, but also just key, what are we looking at in the next 2 days at the conference, 2-3 days at the conference? What should be our focus there?
Hi,
Bridget.
Go ahead. Go ahead.
And I think I want to go to the last slide of Stacey's presentation on manifest choice, that there is no magic pill, there's no magic wand. We need to start thinking around using what we already have and ensuring that we, as much as we demand for these products, to become available and become options in our clinics, in our healthcare systems, it's very, very important that we also demand for demand creation. The uptake of PrEP globally, and when I say PrEP, I mean HIV prevention methods, is really appalling. We need to do something about it, because if we don't do something, if we don't demand some kind of accountability to the people who make the products, to our governments, to funders, to ensure, I have a struggle with community engagement that doesn't talk around, access. A young person in a session say a young person will not take up anything they don't know about. So as much, we must also recognize our own privilege that we know about all of these scientific stuff, but there are communities, there are villages, there are townships that only have condoms, that only have PrEP, that only, oral PrEP, that only have the ring. And we need to ensure these people know that those things are available in their communities or in their countries, and their communities need to access them. So as much as the science is moving, looks cute, and we want to participate, and I also want us to think around what do we have currently and how do we make sure that our communities take it up. Also, just a big shout out to the young people. Like I said, on my speech for the People's Research Agenda, the time is now. We are here. We don't ask where the women, we don't ask where the young people, they're here to open them, and not only in these sessions, but also to recognize the work that a lot of seasoned advocates have done to get us to where this is an intergenerational leadership, where we work into, getting us here. But very, very importantly is, young people, we see you, you're doing great work, and continue doing that. I think the future is safe, but the prevention revolution is yours to make sure we don't go after what is the cutest modality. And we all don't want long shots, long acting and all of that. But yeah, just thought I would wrap this up with the excitement.
Yes, so thank you, Yvette. And my wrap up is just a challenge to all of us who are attending during the poster sessions. I think there are quite a number of posters on community engagement, advocacy, and policy. I think it would really be great to look at those and really collect and highlight the work that is happening, that is done by advocates in that front. So thank you.
Thank you so much. I had something go boom, and yes, Manju.
Sure. I love the way Yvette ended it, and her part, and I just want to back her up on that. In the conference, there are some exciting other things happening as well. If you are interested in going to, we're seeing actual evidence of early experiences with using long-acting PrEP today. And I think that, there was a good discussion yesterday. It was a panel discussion about lots of implementers talking about some of their efforts, their early efforts for long-acting PrEP, and to advise people and see what the uptake is. But now we're actually going to get today a session at the end of the day where we're going to have some evidence that actually talks about the beginning and how they're the beginning of this rollout of injectables and what it looks like. There's also a session looking into the future of long-acting PrEP formulations and other products that are in the future, and a conversation about how we should be thinking about choice in the future with lots of new tools coming up. And I think that's going to be pretty interesting too. And I don't want to go through everything here. I know what I will be listening for is also hearing Latin American voices about the experience in this continent, and also the lack of access, where everywhere we turn, we hear about it in this continent. And I think going beyond what we always talk about, a lot of our focus has been on Eastern and Southern Africa. And so I'm going to be seeking out sessions where I get to hear from other regions, because we really are a global, we really need to look at prevention in a global way. So that's where I'm going to be putting some focus.
Thank you so much. I want to thank each one of you for just joining us. These are going to be happening every day till Thursday, as I mentioned. I mean, we could go on and on about talking about what's happening at the conference, but let's give a chance for our colleagues that are in Peru to go and dive into the sessions. Thank you for joining in, and I will see you all tomorrow, same time, same place. Bye-bye.